Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
So, chest pain. In the chest pain can be either due to cardiovascular causes or it can be due to respiratory causes. In the respiratory causes, pleural pain is one of the most important pain. Pleural pain is mainly caused by the stretching of the inflamed parietal pleura. Whenever there is stretching of inflamed parietal pleura, this results in pleural pain. So, this pleural pain is seen in all types of pleural inflammation or pleurisy. Whenever there is any type of pleural inflammation, either bacterial or viral or protozoal or parasitic, any type of pleural inflammation, chronic or suppurative pleural inflammation, chronic constrictive, any type of pleural inflammation can result in pleural pain. So this pleural pain is a stabbing type of pain and it is catchy. It occurs on deep inspiration or coughing. This is the main difference. So chest pain will not have much effect on the respiration, but whenever the pain increases on deep inspiration or if the pain increases on coughing, then always we should think of pleural pain. And if that pleural pain is mostly relieved by shallow breathing, or if the pleural pain is relieved on lying on the affected side, then that is pleural pain. So in pleural pain, it is a stabbing type of pain which occurs on deep inspiration and coughing, and this pleural pain is relieved by shallow breathing, or when you lie on an affected side, then the pleural pain is relieved.
thank you and thank you for watching.